So I will be debating Professor Moti on optimizing cost of myeloma therapy, whether we can optimize costs or control costs or not. What I will be highlighting is that the current costs of myeloma therapy is extraordinarily high in most developed countries. And this is a problem because some of these drugs are very effective, but at the same time, patients don't have access to them. So the question is, on the one hand, what can we do about the high costs? Is there anything that we as physicians can do to help lower the prices or advocate for lower prices? And I'll be discussing that. And secondly, while that's happening, how do we best deliver cost-effective therapy to our patients? Is there some tricks that we can use to get the most mileage out of the new regimens and new drugs that we have? And this is what I would be discussing. Some of the methods that we can use is if ideally for initial therapy, for example, bortezomib, lenalidomide, and dexamethasone is the standard. But if that regimen is unaffordable, I think bortezomib, cyclophosphamide, dexamethasone, or a regimen like that would be a suitable replacement for patients, which can be given in a more cost-effective manner. Similarly, the duration of maintenance ideally would be till progression. But if patients are simply not able to afford that, then I think having a more time-limited duration of maintenance of 1 or 2 years would be ideal. And some of these questions we need to study in clinical trials. And for example, we are doing that, where in the US, we have a trial looking at the effectiveness of maintenance given for 2 years versus indefinitely, trying to see if we can stop with 2 years and we can save a lot of money, toxicity, risk of second cancers, and so forth. Similarly, we can also adjust the duration of maintenance based on whether the patients are MRD negative or not. If we have a trial which shows that patients who are already MRD negative, they don't benefit from maintenance and you can stop it, that also will save money. So these are some strategies that I will be suggesting. So the discussion on cost of therapy is even more important because even in Western Europe, many of the new treatments are not available for our patients. And part of the reason is regulatory authorities being more deliberate in approving new therapies. But part of the reason is that the costs are prohibitive and it's very, very difficult to afford the high cost of myeloma therapy. And we need to, as a collective myeloma community, come together to see how we can optimize costs so that patients can have access to these drugs. One of the things that we have to realize is that the costs of drugs in the United States matters to Europe, because the fact that pharmaceutical companies can charge very, very high costs in the United States means they are able to walk away from negotiations in Europe. So the high prices of drugs in the US and why those prices are high are relevant even to people in Europe and other countries around the world because it affects your access to therapy.